for Mike Bloomberg to run for another term.
Thank you.
And you, ladies and gentlemen, made that law, and we should respect it. Now, I want to touch just briefly, just for the few minutes I have left, on another subject. You know, we watched Congress work with great speed this week to pass the $700 billion. That's $700 billion. To give you an idea, every year the non-defense discretionary part of the budget, the part that we get control over, is only about $450 billion. That's an entire year's budget. $700 billion. Now the new measure for what's an outrageous amount of money is you look at the Iraq War. It's even more than we spent for the Iraq War. We did that in 1 week. Now I'm not saying the challenge, I voted for. I think that the problems in the economy now, the mess that's been created by the Bush administration, the mess that's been made by deregulation, the mess that's been made by the greed, the mess that's been made, we have to figure out a way to fix. But I want to remind you of something. That there are so many other problems that I think would do as much, if not more, than this bill to get our economy moving. If you think about the number of people that are uninsured in this country right now, the drag that it's creating on the economy, the number of dollars that it's sucking out of our tax budgets each year, if you think about if we can deal with that problem, maybe not in a day, maybe not in an hour, but in the first 100 days of the Barack Obama administration, think about how much better we'd be off. The cost, General Motors, we're bailing out General Motors. We gave them a big loan. It's essentially a bailout for them too. $1,500 of every single car that rolls off the assembly line is health care costs, because that's how much their costs are rising. Here in the city of New York, we have 1.2 million people who have no health insurance. 500,000 people who are people that get up in the morning, go off to work a long day, work a long week, come home. They're not slackers. They have no insurance. 500,000 people. But ladies and gentlemen, make no mistake. They're getting health care coverage. But they're getting it in the least effective, least efficient, most expensive way you can imagine. They're showing up in emergency rooms. They're coming to the school with your children. They're coming sick and making everyone else sick. There's a better way to do this. Now, we talk a lot in this campaign about health insurance. We've got to change the direction. What we're thinking about, not health insurance, but health care. You know, giving someone a health insurance policy, it's a good objective if that's the only thing we can do. We in the city have the ability to do much more, and let me tell you what I proposed. I gave a speech called Healthy New York, where I suggested that what we do is we take the money that we're spending now on the uninsured, which is a considerable amount of money, it's in the billions of dollars, and say, rather than pay that for the uninsured in hospital emergency rooms, rather than paying it in the form of Medicaid expenses that are just going through the roof, we should capture that money. And we should take our Health and Hospitals Corporation facilities. We have you, the taxpayer. You own hospitals. You employ nurses. You employ doctors. You employ EMS. We have no shortage of health care in the city, but the way we're distributing it is all backwards. And what we should do is we should take that and make our HHC facilities essentially a giant, no-cost or very low-cost HMO for the uninsured and for people who are in small businesses. I believe that we can do a lot better. Right now, we're paying $2,300 a month for every uninsured New Yorker. I believe for much, much less than that, if we can get them the preventive care, if we can get them in all of their communities, if we can use the facilities that we have. David Dinkins tried this right before the economy started to go into the tank and essentially tried a model very much like this. And what did we find? We found that productivity in those communities went up. We found the number of sick days that were taken went up. We found out the number of sick days for the children in those communities went down. We found that even some things that you wouldn't expect, the number of teacher days that were lost in the city dipped down. Well, why? Fewer kids were coming into classrooms sick with colds because they were getting treatment. And we have to do something. Now, the reason it's an imperative, particularly to this audience and to this organization, is the undisputed disparity in healthcare that goes on in this country. Not just between the wealthy and the less wealthy, but among the races. I wrote down a couple of statistics on the way here. You know, I told you about that giant number of uninsured, 1.2 million uninsured. Do you know only 11% of them are white? It's almost, the statistics in the city are reversed when it comes to the uninsured. The black, you know, we know what the percentage is, the African-American population in New York City. Well, I'm going to tell you the percentage of the HIV death rate. 55% of the HIV deaths in the city are African-American. The infant mortality rate in our city, 5.9%. Among African American families, 10.5%. So healthcare is not only something that the GMs of the world need, not only something that people who run cities and run countries need to figure out a way to spend money more efficiently, but this is a quintessential civil rights issue in this election. Now, tomorrow I'm going to be campaigning in Pennsylvania for Barack Obama. If you believe, or you have neighbors who believe that, you know what, politics, they're all the same, they all sound the same, never in an election in American history have the choices been so stark. We saw in that debate the other night, we saw undeniably we saw a vice presidential candidate who had nice legs. I won't dispute that. But we also saw a vice presidential candidate who tried to explain her running mate's health care position, which is to give everyone a $4,000 voucher and say you're on your own. On the other side of the stage was Joe Biden, who explained that for the first time we're going to have a president on January 20th who's pledged to cover all Americans with health care. This is not a party issue. This is not an ideological issue. This is simply a question about what kind of an economy we want to be, what kind of a country we want to be, what kind of families we want to have, what kind of job environment we want to have. If we don't believe it is a basic right of all Americans to grow up, be healthy, and die after a long, healthy life, seeing their grandkids grow up the same way, I can't think of anything more important. So as you go from here, you've got a lot on your plate. I saw the agenda. I saw there is a lot of very important issues. This is one. And let me conclude with this thought. You know, I, as part of preparing to run for mayor again, have been talking about a series of initiatives. The idea of really having faith-based initiatives by having a nonprofit czar who sits at City Hall to try to help church-based, synagogue, mosque-based organizations get access to public funds. It shouldn't be who you know. It should be what you do for our community. That's how you get the funding. I talked about how we make our tax code more progressive for middle-class New Yorkers, those who are trying to get into the middle class. Talked about how we're losing jobs, how incomes are going down, and how we have to do a better job trying to keep them here, not just in the financial markets, but all around the 5 boroughs. Throughout, I presented this idea for health care. You've already seen the impact of the mayor's announcement about term limits. You had 2 other candidates who were going to be here, tell you what they thought, roll out their initiatives, engage in a debate, a contrast of ideas that was going to make our country better and our city better, and they're not here. Now, I don't want to say why they're not here, but I think it has something to do with the idea they decided, you know what, I'm safe where I'm sitting, I'm not running for anything anymore. We have to remember that this is a process that is not about TV commercials, it's not about fancy newspaper literature, it's not about polls. It's about the ideas, it's about our neighbors, it's about the future of this country. So let's go get them. God bless America. Thank you very much.
Anthony Weiner. As I turn it back, I just want, I talk a lot about how the media sensationalizes out of all the substance that we did today and all of the substantial things both Mr. Thompson and Mr. Weiner said. I'm sure tomorrow's paper will say Weiner said Joe Biden had nice legs. He did.